Assalamualaikum and Selamat Hari Raya everyone. Good evening. Thank you for finding your time, especially during this Raya season and joining our CME organized by CME MedTweetMY Professional. We are so glad to see such an overwhelming response and attendance from today's CME. And today we are live not only from Zoom, but also from Facebook live stream as well. So I'm Adila, your moderator for today. Firstly, I would like to remind, if you have any question, you can write in the Q&A box below and we will address your question towards the end of our session. You can write the question both in our Zoom and also Facebook live stream, and we will address the question both at the end of our session. And great news, you will get 1 CPD point from today's session, and we will provide the link for the e-certificate and also for the CPD point at the end of our session. And for the link, we will open only for 30 minutes after we finish our talk. And after that, we will close the link and you cannot request for a repeated link or anything to get a CPD point. So today's topic is indeed very interesting. So as we often receive complaints, not only from our patient, but also from our relative regarding hair loss, or maybe it's just for us. So our discussion today is about the prevention and also management of hair loss. And we are so grateful to have Dr. Syazli Rodzian Ahmad Kamal, a consultant plastic and reconstructive surgeon and senior clinical lecturer from Avisena Specialist Hospital Shah to share with us regarding today's topic. Dr. Syazli graduated in the year of 2022 and completed his postgraduate in plastic surgery in 2012. He has done multiple researches and top retaining his field of interest, including burn management, liposuction, as well as grafting. So without further ado, I would like to invite Dr. Syazli Rodzian for today's talk. Please welcome.
Thank you, Adila. Can you hear me?
Doctor.
All right. So as we know, the topic today is we are talking about the common problem that most of us or almost all of us has faced, either ourselves or our patients that ask us about this. This is a topic about prevention and the management of hair loss. So how we are going to talk about this topic is I'm going to try to take into account in terms of the whole aspect of management without going too detailed, but at least you get a better picture after the lecture. So the outline of the lecture would probably be this way. I'm going to talk about the basic of anatomy and physiology of hair.
Dr. Syazli, share screen?
Yeah. Sorry?
Share screen. Slide.
Yeah. Oh, okay, sorry. Okay. Right. Can you see now?
Yes.
All right. Sorry. Okay, now, so the topic will probably be about management of hair loss and tips as well as the what are the latest updates in the management of hair. Now, as I mentioned earlier, the outline of the topic, we are going to talk into this anatomy and physiology of the hair. And we are going to look into the hair growth cycle. This is also very important for you to understand what actually is the basis of all the treatment in hair management. And also the basis of the pathogenesis of the common problem. So the common problem that you have either is male pattern baldness or because of medical problem, or is it because of physiological problem? It goes back to the basis of this physiological process. And why do people get male and female pattern hair loss? And the classification of the hair loss. So what are the common classification that has been used in terms in the standard text and in a way for us to communicate? Also, we are going to look into the clinical assessment of hair loss patient. How do you assess the patient with hair loss? The patient comes to see you. What are the clinical assessment that should be done? The relevant investigations that should be ordered without being overdone in terms of we want to save the cost for the patient, but at the same time we want to get the best information. And finally, what are the surgical and non-surgical treatment for hair loss in the updates? No, so I'm not going to only focus on surgical part, which is the hair transplant, but we will see what are the non-surgical part of it, which can be used in combination or without patient needing to go for transplant. So some patient might be beneficial for them just to go for non-surgical, they get good enough treatment, then they can just continue on this for a few years. And finally, what are the common tips for healthy hair? So these are some things that we can share. So probably if you have some ideas or some experience yourself, you can share with everyone here as well, the tips. Now, hair is something that cannot be separated from the human species. So we know this is probably the most famous hair that almost everybody knows by this lady. So the trick is you cannot look into her eyes, but you can look into the hair. So her hair is probably the one that is being discussed forever. So we know hair loss is not only affected, it does affect a lot of people from all classes of life. And some people that you can see the profile when they have hair loss actually change, but it's actually not a problem that to say is a medical problem per se in terms of it's a disease that we should treat, for example, like it's actually a disease that should be operated, or it's a fracture probably that should be treated. But in a way, it also encompasses the psychological aspect of the patient. Some patient feels when they do hair transplant or they do hair treatment, they get more self-confidence. And when you look into this aspect, you can actually consider this part of it as a medical treatment. In terms of the market profile for hair treatment alone is something that also can be looked into, as the profit margin is projected to go very, very high. That's why in terms of the treatment or the market component of this, there's a lot of people without qualifications that's been doing this treatment outside and causing a lot of problems. And as far as this issue is concerned, the Ministry of Health is doing a lot of upgrading in terms of their regulations to ensure safety for the population. All right. Now we go for the anatomy of hair. So this is the basic anatomy of hair. So if you look into the hair shaft, we always has these are the basis of this is made up of this root of hair. This is the follicle of hair. And then it contains in the follicle is the root where you have the dermal papilla. And then you have the sebaceous gland that supplies the moisture to the hair. And then you have the shaft. So this is considered as one follicular unit, one follicle. So this is one follicle. But when you talk about follicular unit, it can consist of 1, 2, 3 or more follicle. So it depends on how many of the follicle is contains in one unit. Now, when we talk about hair transplant, actually, by definition, hair transplant is a procedure where you take the follicle. So the true the true nomenclature, or the true words that you should say about hair transplant is actually a follicular transplant, not hair transplant, because you take the follicle. So for hair, we actually have these two types of hair. You have what we call as a vellus hair, and then we have what we call as a terminal hair. Now, this is another important concept when you want to understand about the process of balding or the process of hair loss. So for a baby, when we are born, all of us, we have what we call as a vellus hair. So this is a vellus hair. Vellus hair is a hair that is fine. The shaft is shorter, as you can see here, and thinner. Whereas the terminal hair is the hair where the shaft is longer and at the same time is wider. Right? So this, when we are a baby, so we're just born, our hair is actually a vellus hair, and then it grows into the terminal hair. So similarly, when you are experiencing hair loss, or you have what we call as a male pattern baldness or a female pattern baldness, the hair does not just disappear. So what happens is the hair will reverse. From the terminal hair, it goes back to the vellus hair. So it becomes thinner and shorter. So if you look into under some examination like a trichoscopy, I will show after this, the hair actually is there, but it's thin and short. Now, this is a very, very important concept in terms of hair restoration principle, because by understanding this, then we can actually go into the mechanism of all the treatment modalities that's available that we are going to discuss tonight, right? Now, why actually does the hair goes into from terminal to villus hair? Now, before we go into that, you look into this is what we call as a hair cycle. Hair cycle contains of these 4 phases. You have the active anagen phase, and then we have the catagen phase, the telogen phase, and the early anagen again. Now, the anagen phase is where the hair actually grows. And then after it completes the hair, it goes into the period where it starts to shed off. So this is the catagen. Now, after that, it goes into the telogen where it falls off. Again, this is a very important concept when we study about hair loss. We found that in certain condition, the telogen phase becomes prolonged and the anagen phase becomes shorter. What are the examples? So examples, it can be in physiological condition, for example, like post-pregnancy. So when patient just delivered a baby, because of the hormonal change, it actually causes the telogen phase to become prolonged. That's why patient has postpartum hair loss. Understand? That means postpartum hair loss is because of the prolongation of telogen phase, but this is actually physiological. So sometimes when patient come to see us, after delivery, they complain of hair loss. It does not necessarily means that hair loss is permanent. So you can actually reassure the patient. You tell them this is a physiological process. After 6 to 9 months, the hair will regrow. So you can actually prescribe what we call as a healthy lifestyle tips for them that we're going to again to discuss later on. Similarly, if you have a patient on certain medication, for example, like patient on chemotherapy drugs, again, it affects these phases. So sometimes you have a prolongation of the telogen phase or shortening of the anagen phase. Again, patient complain of hair loss, right? So these are the physiological part of the hair process, hair growth process. Now, again, before we go again into the pathological part of the lecture, again, this is another concept because I want to get clear of the conceptual basis first before we discuss into more detail. Because once you understand the conceptual basis, it's easy for us to really understand what is actually the whole business of hair restoration is all about. Now, just now I mentioned about the male pattern baldness and the female pattern baldness. What I mentioned is the male pattern baldness, the hair becomes short and thin before it falls off. So why actually some patient has this male pattern baldness, some patient actually does not have male pattern baldness. They do not have male pattern baldness. Whereas some patient they become bald, but some patient they do not become bald. There must be a reason behind it. Then people did some scientific studies. They found that because of this, what we call as a DHT receptor. So the DHT receptor is a receptor that is located at the root of the hair follicle in certain patient that is affected by this condition. So because of the receptor is there, the DHT, which is actually the active form of the testosterone, is being attached to the receptor and it starts the process of the hair becomes villus hair. Again, similarly for the ladies as well. So because of the receptor presence, right? So some patients, they do not have much receptor. So even though the testosterone is very high, and because of they do not have much of a receptor, the process of the reversal of the hair from the terminal to villus hair does not really affect this. Does not really affect them so much. Actually, this process of the effect, the way how the receptor affect is first being noticed by Hippocrates, Hippocrates. So he actually found this process. So he found from his observation, eunuchs, those that has been castrated, they do not have testosterone anymore because the testis has been removed. This patient have very thick hair. So because of this observation, then he actually made the conclusion, so he's actually not as well known as the Hippocratic Oath, but he actually made this observation as well. Now, we go into the type of the hair loss. Again, this is more relevant to us as doctors when we see patient with hair loss. We need to see them as a patient. At the end of the day, before you go for all those cosmetic treatment, you must understand that it can be a underlying medical condition. So how you classify hair loss? Hair loss can be classified into androgenetic, which is a male or female pattern, or non-androgenetic, which can be other causes. And non-androgenetic can be cicatrical and non-cicatrical. Cicatrical means scarring lah. So that means it can be a scarring pathology of the scalp or non-scarring pathology. So these are some of the example. You can actually take this capture screen of these photos and go into the detail of the disease that I listed here. But this is basically a big classification that you can actually start to look into when patient come with a hair loss, so that I'm not going to go into too much detail, but you can see that cicatrical scarring can be under infection. For example, like fungal infection, they have Rickettsia capitis. It can be inflammatory. So because there's a lot of infection going on, they can have things like central centrifugal or folliculitis keloid, dissecting cellulitis, where the scalp actually becomes like an abscess, multiple abscess on the scalp. Lichen planopilaris, LPP, FFA, or discoid lupus, a sub-condition of the discoid condition where they have actually affect the scalp. And also the scarring can be because of trauma. The patient can have injury before, patient can have radiation, or patient can have surgery. Again, of course, they can have a neoplastic condition of the scalp, the basal cell or the squamous cell carcinoma. The non-cicatrical or non-scarring part of these causes of hair loss can be things like mineral deficiency. That's why it's important to look into the zinc and iron. Thyroid disease, yes, hypothyroidisms. The effluvium, meaning that this is a condition where the telogen phase is prolonged. So it's called a telogen effluvium. And this one I mentioned can be because of a physiological process, because of drugs, and of course PCOS. And traumatic traction, this is something that is there if you like to do a lot of ponytail, which is the traction is very strong. To a certain extent, it does affect the hair root, but yes, so this some degree of trauma to the follicle is there. And again, hair shaft abnormality. So assessment-wise, when patient first come, again, we do the basic medical and physical medical history and physical examination. But some salient points that you can look into are in the history whether the hair loss is gradual or progressive. If the hair loss is gradual and progressive, that means it's actually something that is not too rapid. It goes slowly, but it becomes more and more. So you can look into the possibility of an alopecia areata or the PCOS conditions. Alopecia areata is actually a condition where there is a patch of baldness of the scalp that affects a young male or female that comes and go. And this bald patch is because of an immune reaction. And usually this type of condition, the treatment is you have to stop the immune process by giving an anti-immune treatment like a steroid injection. And you also have, if the patient come with hair loss which is diffuse but rapid, that means it's all over the scalp and it's very fast. So you must think of, again, telogen effluvium conditions that can be because of physiological process or because of underlying medications. They can also have what we call as a diffuse alopecia areata, meaning that alopecia areata that is not only localized but now become diffuse. Again, if it's localized but rapid, that means it's a small patch, rapid, you must again think of alopecia areata. And again, this list is not exhaustive, meaning that there, of course, there are other things that you must look into, but I'm just going to go into the an overview and just a simple way to look at the history, but not exhaustive, meaning that you must, again, if you want to go into detail, the slides that I showed earlier, go back and read again into all the disease there and try to understand so that you get a more comprehensive review of the medical causes of hair loss. Again, autoimmune diseases, dietary restriction must not be overlooked, especially in young patients, and of course, if they have psychological conditions. Examinations, you can see this is what we call as a trichoscopy, meaning that you have a scope that you can look into the hair. So if patients have broken hair, variable length, yeah. So There can be a trichotillomania or traumatic breakage. That means the hair is actually healthy, but it actually in a variable length, meaning that it's being pulled. And because of that, the growth of the hair is in various stages. Peripheral exclamation point is in patient with an autoimmune condition like we call this alopecia areata, but this can be seen under the trichoscopy. Surrounding skin is another condition, another clue that can give us to the ideas. So if you look into the patient, just look into the skin around it. So whether the skin is inflamed, whether the skin is atrophic and shiny, and if, or of course, if the skin is normal. Even if the skin is normal, it can give us a lot of clue. Remember, I can tell what I said just now is non-cicatrical. The skin is actually normal, but they still have hair loss. So you can see if it's inflamed, it can be because of infection. And then you also have is shiny, you have scarring alopecia. And then you also have when the follicle is normal, you can have a non-scarring process. Right. So now we go into the physical examination. Physical examination again, it must be done as in any other patients that come to see us. Complete physical examinations without shortcuts is still mandatory. But there are some extra points that you can do is you must again you can do these two things, what we call as a hair pull test and the hair tuck test. What are the difference? In the hair pull test, we just pull the hair from the root. Whereas in the hair tuck test, it's like you know, the tuck, the rope tuck, tarik tali kan. So we actually hold the hair at the base, and then we hold the other fingers at the upper part of the shaft, and then you pull. So you want to see the middle part of the hair, whether it breaks or not. So this gives clues, the integrity of the hair shaft. The hair pull test, you want to see the integrity of the follicle. So the normal one, if you pull out the hair, it should be about only 5 to 6 hair, less than that. So if you grasp about 60 hairs, but if you pull and then it comes out more than that, then you can see that it's not healthy. Similarly, if the hair tuck test, if you pull, then the hair starts to break. Again, it gives a clue that the hair is not healthy. In terms of blood investigations, the common investigation is you can do the iron, zinc, and vitamin D, thyroid antibodies and thyroid function tests, testosterone level, and of course, all those anti-immune screen, autoimmune screen, and full blood count to look at the full blood pictures. Trichoscopy is one of the techniques that we can do nowadays to look into the scalp. So it's actually available online. You can get it very cheap, probably about less than 500 ringgit. You can get a good machine. Some of the machine can be projected on your handphone straight away through your Bluetooth. Some can be projected on screen so that the patient can see. So it can give you, I'm not going to go into all the trichoscopy findings for all these conditions, but basically what I'm trying to say is all these conditions, you can give you more clue when you look into the trichoscopy. Again, I will advise everybody to probably just browse through all these topics, and maybe you can look into the image of the trichoscopy findings so that you get more clearer picture what are the difference, right? So this is hair transplant procedure. When we go into the restoration phase, we have this what we call as a hair transplant. This is in setting in my clinic. And this is how we do a hair transplant, where we take a single graft. So when I mentioned about the follicular unit, this is what I meant. You see some follicular unit just now. It contains about 2 hair. Some follicular units, they have 3 hair, and then some follicular unit, they have 1 hair. But some actually have 4 hair. It depends on the type of the scalp. So if you have, for example, like a single hair, again, this goes to the technical part of it, where we can put a certain area, let's say, for example, the frontal scalp, or you can use 2 or 3 hair in behind the single hair unit. So some of the condition where you have a scarring alopecia, and these are conditions where it can be beneficial. And nowadays we can also do for patient with cleft, or patient with cleft lip surgery, to remove the stigma, you can do hair transplant. Right, now we move on to the next part of my lecture, which is the classification of hair loss. Again, this is good in terms of for the communication between the medical units as well as for the patient recording purposes. You can classify the standard accepted classification unit for hair is for men is Norwood Hamilton scale. This is a scale that look into the type of hair loss. So if you, for us to take notes is that we have this 7 scale, but not necessarily the patient can start with 1. Remember that. So you can actually have a situation where you can start with straight away with vertex. You can start with maybe probably more towards number 3 vertex. So that means the hair can actually be integrated. The hair is actually full in front, but they could already start the loss on the vertex part, which is the middle part of the head. But these are the processes where you have 1, 2, 3, 4, 5, 6, and 7. For the ladies, and you have a hair loss for the female pattern hair loss, the scale that can be used is this is what we call as a Ludwig scale. And as you can see from this picture, female pattern hair loss is slightly different from male pattern hair loss. Because in male pattern hair loss, the hair loss usually start from the front. And then you get the development of the M shape. And then it becomes more and more progressive behind. But female usually start in the middle. So it starts in the middle and then it spread centrifugally. So these are what we call as a female pattern hair loss. But in terms of the pathogenesis or the process is almost the same because of the receptor to the DHT. Again, I've shown this earlier on. You can see the process is because of the receptor activation by the DHT. Now, in terms of treatment for the hair loss, I'm going to look into the non-surgical procedure first. Because sometimes when patients come and see me, they ask about what can be done. Can you straight away do hair transplant? So what I tell them is hair transplant is not the only treatment available. Some patients can get the benefit from non-surgical part of it. That means you can actually start with something that is not straight away go for invasiveness of the transplant. So for example, like you can do things like we have oral medications, you have the hair stimulation shampoo, and you have topical medications, injectables, and light therapy. So what are these? So we are going to look into all of these one by one. Now, oral medications, again, it's very interesting. You have this, what we call as the finasteride and also the dutasteride. These are all anti-testosterone treatment. Initially and until now, it's still being used mainly for benign prostatic hyperplasia because of the activation or the action on the testosterone. It reduces the size of the prostate hypertrophy. But as we discussed earlier on, because it acts again on the testosterone, reduces the amount of testosterone. Similarly, it also reduces the action of the DHT to the receptor. So because of this, it stops or it reduces the progress of the hair loss. So you have this first generation finasteride. It acts on the receptor type 2, DHT receptor type 2. And then you have the newer one called the dutasteride, which acts on the receptor type 1 and type 2 for the DHT. So the side effect profile, usually when you give finasteride and dutasteride, you must be careful about the side effect profile because it acts on the testosterone. Again, some patient may have the effect of reduced libido, and they feel tired, lethargy, all those effects when the amount of testosterone is reduced. So this must be explained to the patient. But the good thing is that it comes out that dutasteride is the side effect profile is known to be slightly lower than the finasteride. Now, at the moment, recently I went for a World Congress meeting for hair services in India. So over there, they actually already have a topical dutasteride, which is very interesting. It has not come into Malaysia yet, and it's not being used worldwide. I think probably it's in the early stages of the development of drugs. And because of this, they consider that the side effect profile is much, much lower because it does not go into the systemic circulation, which is something that's very interesting. So you have what we call as a topical dutasteride. Again, you also have what we call as a minoxidil. Minoxidil is, again, a topical treatment, acts on the scalp. But the thing about minoxidil is it actually is it causes the vasodilatation of the vessel of the scalp. So, and because of this, the effects of minoxidil can cause the patient to have hypotensive episodes of postural hypotension. So that's why, again, this must be explained to the patient before we prescribe the treatment to the patient. So minoxidil again the commonly being used is the topical part, but at the moment in Malaysia has been approved the usage of an oral minoxidil, and oral minoxidil is been widely prescribed. Now, before I forgot, in terms of finasteride, sometimes some patient will ask, can we use this in ladies? Because when they have female pattern baldness, can you prescribe the finasteride in ladies? So if you look into the FDA circulation, they will say that in terms of the guidelines, not advisable or not being approved for female usage because there's some degree of teratogenicity. Especially in terms of also for dutasteride. So it's not being approved for the usage of lady, all right? Now, the next one is the light therapy. This is again something very interesting because actually this light therapy, or what we call as an LED therapy, this is not a laser therapy. So this must be very clear. Sometimes when we look into all the advertisement, people will say that it is actually a laser therapy. But it's actually not a laser therapy. It's just a LED light therapy. So why do I say it's not laser therapy? Again, this goes back to the basic principle of laser, meaning that by definition, a laser therapy must be something that is only a single wavelength. So that is by definition. That means you must have a single wavelength. For example, if the wavelength is 135, for example, for laser therapy, only a single wavelength of light that is emitted from a single source, then only it can be considered as a laser. Whereas when we talk about LED light, it's actually a combination or spectrum of light. So it combines about 2 to 3 wavelength of wavelength of light that is being emitted together. So by definition, it's not considered as a laser therapy. So I mean, for medical personnel or for doctors, it's easy for me to explain. But when talking to the patients and when they look into Google and all that, they consider this as a laser. And so everything is laser. So even when you do circumcision also, it's a laser circumcision, but it's actually a diatomy. So, but again, LED light is something that is being used, and it's been shown that the light emitted has some beneficial effect in terms of increasing the circulation to the hair follicle and etc. But the evidence is not strong. It is more of an anecdotal, but again, of course, some patients see the benefit and you can actually use this in your practice. So this light therapy. Hair loss shampoo, again, there are many in the market. I'm not prescribing any brand, definitely not this brand. This is just an image that I take. In my practice, a lot of other brands I use, but it's more of a commercial use, and you must look into the effect, how it works in terms of hair loss shampoo. A lot of patients will usually come and they say they have been using a lot of shampoo they buy from the pharmacy and all that. I think for me, how I approach is as long as it's not detrimental to the patients, it's a very mild effect. I mean, in terms of improvement, they are very happy and it is not against the medical punya guidelines. So I say they can continue lah. Because at this point of the lecture, all of us are very clear about the causes of hair loss and how it acts in terms of the physiological process. So this shampoo can be something that can give benefits, but sometimes the pathway is not as clear as what we have understood. But yes, there's a lot of shampoo in the market that has been shown to be beneficial to the patient. Sometimes the traditional things that they use, for example, like a coconut hair, of course, I got a lot of patients that come, they use a special type of mixture of coconut hair that they use and apply to the hair that actually causes the hair to actually regrow. Again, I will tell them that, you can use, but just be careful not to overuse, because sometimes you use too much coconut oil, it will actually block the follicle and it can work the other way around, causing the hair to fall. This is something that is available in the practice that you can call what we call as a tattoo process, where you can actually do some tattooing of the scalp to imitate the shape of the hair. For non-surgical procedures, we have what we call as injectables. So the injectables are where you actually inject this medication or this agents into the scalp to stimulate the hair to grow. So injectables, again, that I mentioned, can be used in combination with other treatments or can be used by itself alone. In my practice, usually I will use this in combination with the oral medication, the spray, the shampoo, and sometimes I use this as a preparation before patient going for hair transplant. So again, you have these 4 things. You have the PRP, the stem cell, the cytokine, and the mesotherapy. PRP is actually, this is one of our patients where we did a PRP. PRP is platelet-rich plasma, where you actually take the blood of the patient, you centrifuge the blood, and then you extract the platelet-rich plasma, and then you use this to actually inject into the scalp. I think this is a well-known procedure, especially in our medical fraternity. The orthopedic surgeons use it for conditions that affect the joints. And then sometimes aesthetic physicians use it for the facial rejuvenation process. But for hair transplant, it's been shown that when you do PRP, a lot of studies have shown there is biomedical part in terms of the processes, because the release of blood platelets and all the growth factor actually stimulates the formations of all these new follicles, and as well as neovascularization of the hair root. So because of this, it can be used in combination with the other treatment. So even histopathological studies of PRP also shows that there is actually an increase in the thickness as well as the vascularity of the scalp and the hair follicle area. Stem cell is something also has been in the scene for quite some time now. Instead of, it's actually a more refined way to actually stimulate the hair growth, because actually in PRP, you already have stem cell, because stem cell, it resides in the adipocytes. So when you actually have all the growth factor, you can actually activate the stem cell formation as well. But in this type of treatment, you actually just take the stem cell alone, you process it, and then you use that stem cell to treat the alopecia. Now the next part will go into the hair transplant procedure. So we have discussed earlier on. For now, just to recap, I've discussed from the beginning what are the conditions that can cause the patient to have hair loss. And we also discussed a bit about the anatomy and physiology of hair loss. And then we discussed about the medical part of it, medical component of hair loss. What are the non-androgenetic, meaning that the hair loss is not purely because of male or female pattern, but because of an underlying structure. So again, I've shown about how you classify into 2 types, whether it's actually scarring or non-scarring, meaning that the causes of scarring and non-scarring hair loss must be ruled out before we decide that this is actually purely just a androgenetic, meaning that it's a male or female pattern. But this process is not too long. From history or an examination, more or less, we can come to this conclusion straight away. Now, when patient decide and you decided the patient to do hair transplant, so the process of hair transplant, there are a few things that we will do in the initial consultation. So meaning that as most important part is the expectation of the patient and what can be achieved. So that means if patient expectation is too much and the reality is not as much, this will cause a lot of problems after the procedure. Again, we look into the donor and the recipient area. I will show again what is meant by this. So we'll just go quickly about the process of a hair transplant today. And then the nature of the hair loss, again, very important, the progressive nature of hair loss. So because hair loss is a continual process. That means when you do hair transplant, you must factor in that the patient will continue to lose hair. So if you just do hair transplant on the anterior part, you finish all the hair, put it on the anterior part, 15, 20 years down the line, when the patient continue to have hair loss, behind the hair, there will be a lot of problem because there's no more hair to put there. So again, this is another thing that must be taken into consideration. Again, of course, complications. So the common type of presentation is patient with hair loss that happens on the vertex. Investigations, the ones that you can do, again, these are the common ones, the standard investigation, and we look into all this early on. and the restoration process. So now this is one of the example of patient that we did. So like I said, when this patient came, this photo is before on the left side. So the concern of the patient is the hair loss is progressing on the anterior part. So what we did is we did the patient on anterior M-line hair transplantation, and the result is after about 9 months. So again, when we talk about hair transplantation to the patient, the important thing is the amount of hair that you take must correlate with the patient's complaint. So if the patient has so much hair loss, but the hair that can be taken is very minimal, so again, expectation of the patient must be addressed. So there are certain strategies that we can do. For example, like we can do certain areas to camouflage the hair, but not as much as we can do every part of the scalp if the hair donor is not much. So sometimes even we have patients that ask, can you take the hair from somebody else? So they want to donate, probably their friends or their brothers or family members that want to donate hair. So of course the answer is no, because it's actually a live graft. So when you do a hair transplant, the hair will grow, and because the hair will grow, it is a graft that must be alive. So if you take from somebody else, it will be rejected, and then the hair will fall. So another factor is whether they are Caucasian and they are dark skin. If Caucasian, you also, another important aspect that we look into is the contrast. So if a Caucasian with white hair or a dark skin with dark hair, again plays an important role. If patient is a white hair with a dark scalp, so the contrast will be more. And again, this also plays a role in terms of the outcome. So these are some of the detail of the hair transplant. I'm not going to, again, to go too much detail, but you see the design of the hairline when we do anterior part is this way. So it's not a straight line, smooth, it's a zigzag. So our hair, actually the hairline is zigzag. So if it's too smooth, it doesn't look natural. This is another patient. This is what I meant when you don't have much of a hair to donate. So this patient is about 50 plus years old, and he has hair only on almost a whole scalp, but the donor side is very limited. So what we did for this patient was that we stimulate the hair growth by doing all the non-surgical part that I explained earlier to boost the hair, and then we concentrate the graft on the anterior part. Okay, now, so again, when patient goes into hair transplantation, another important aspect is after about 2 to 3 months after the hair transplant, all the graft that we put will fall down. And this is what we call as a shock phase or the transition phase. This is very common. So if you see a patient post-transplant, let's say 1 to 2 months, initially they have maybe about 95% or 97% coverage. When patient come to see us after 2 months, the most or 50% of the hair will fall down, and patient will be in shock. But what you need to tell them is because the graft has survived the first month, most likely the follicle is already there, the graft is already there. It's just that the shaft is being changed. So this is called a telogen aphasia. That means a transitionary phase, and it will resolve by the 6 months, and it will regrow back. This is an example of a case that I did where the hair is actually very scarce. 1 month after the transplantation, you can see the area of alopecia actually increases. And after 4 months, you can see it grows back. So we actually did the transplant. You can see the follicle is there. It is alive, but the hair is actually become bald, before at 1 month, but after 4 months, it is growing back. So this is what we call as a transitional phase. So the pre-op planning, again, we look into the timing of the treatment, the topography of the scalp, the donor site, and the quality of hair, the ratio, the distance. Yes, are very technical, but I'm just going to go into the overview of it. So again, the procedure starts with an injection of anesthesia. We do a ring block injection. And then the hair usually is being taken from behind, from the occipital scalp. And the hair is being transplanted into the anterior part. There are 2 ways to do. If you look into the literature, people talk about FUT and FUE. FUT is a technique where you cut a strip of the scalp, and then the strip is being cut by your assistant, being sliced. Whereas FUE, you take one by one with a special machine. So this is the two techniques that are being used. So most of the techniques carries its own risks and benefits. So this is my patient. This is me doing what we call as an FUE. You can see there's a special machine that we use to harvest the follicle one by one. So the advantage is because it's one by one, the healing is actually better because there's no long scar and pain is less, and recovery also is smooth. But again, I'm not saying that FUE does not have a role. You have a role in certain instances. For example, like patient with very limited hair, but it's more technically challenging to do. So this is how you look into the punch when the hair is being harvested. And this is what we call as FUT, the strip technique, one long cut there. There's a lot of bleeding. So usually this one is being done by surgeons. And otherwise scalp can be quite bloody if you're not careful. Whereas this is FUE. That looks very scary, but usually by the first weeks and the second week, the hair will grow back and everything will be covered. So not much of a donor side defect is there anymore. So this is the FUT where we slice one by one after we cut the strip. And this is FUE, all right? So we must look into all these factors when we prepare the patient to minimize the effects to the graft. And the plant technique is after we have taken the graft will be put into the recipient site by two ways. Either we use it as stick and needle, or we use a special implanter called the Choi implanter. And graft incision must be done. Again, these are very technical, how we do it. But generally, these are the two techniques where you use a stick and plant, where a needle is being used. This is on the left side, and the implanter. So for me, I use both depending on the indications. So this is again the patients that we explained earlier on, and some of the patients. Now, again, post-operative hair growth cycle, you see that nothing much. Usually we will tell the patient the graft will be result usually will come after 9 months to 1 year. So that's when all the thing has gone through all the phases. But I just want to show that between the first to third months, this is the phase where we call the telogen phase, where the graft will fall down. But it's actually not the graft that falls down, it's just the shaft being changed, and then it will regrow back. And post-transplant care, you have to do all this in terms of the tips. All right, these are the last two slides. What are the side effects? Again, at the end of the day, hair transplant is considered as a surgical procedure. So there's a lot of regulations that's been coming up, especially by the ministry, where we want to actually make this very safe for the public. So for those that are interested, the ministry will come up with some sort of regulations to ensure that the treatment is standardized. Because transplant, if it's not careful, it's still a surgical procedure that can cause all these complications, swelling, bleeding, infection, and not to forget the anesthetic complication. All right, the last slide, some of the tips. These are the things, sometimes a lot of patients will come and ask what are the things that you can do to improve the hair. It's basically a simple tips that all of us actually knows this, but you can actually enhance their belief. For example, like a balanced diet, especially those that contain iron and zinc and omega-3 fatty acids. So these are things that is contained in the keratin part of the hair. So you can encourage them to take this. Hair care, again, we might take this as for granted. So shampoo, proper shampoo, try to limit the what you call that, the chemical that you use to the hair, and always hydrate the hair, the scalp care, and the styling of the hair. Again, especially for the ladies, the ponytailing of the hair can actually cause a lot of stresses to the hair. But I'm not saying you can do it at all, but just be a bit more gentle to the hair. Other than that, stress, sleep, exercises, hydration, and supplements are self-explanatory. So, okay, that's about it then. I think about hair transplant. Thank you so much.
Thank you, Dr. Wan Shazli Rodzian, for a detailed and also insightful explanation on prevention and also management of hair loss. And first thing first, we have to remember that we have to identify and find the cause of the hair loss before we proceed with the treatment. We have a surgical, non-surgical, there are multiple treatments, but the most important way is to prevent by living a healthy lifestyle. So this is not only applicable for our patients, but also for us as a human being lah. So I would like to remind that we provide the link for the e-certificate and CPD point at the end of our session, and we will open the link only for 30 minutes, and after that we will close the link. So any other requests after that 30 minutes, we cannot entertain. We are really sorry for that. So without further ado, we actually have a numbers of questions, both in a live stream Facebook and also from from our Zoom. So I'll pass the floor to Dr. Faiz and also Dr. Iskandar for the Q&A session.
Okay, thank you very much, Dr. Dina. And again, thank you very much to Dr. Wan Shazli, our esteemed speaker, for such an exceptional lecture. We got a number of questions tonight because this is the topic of conversation. The question keeps on increasing. So I think without further ado, we can start with the first question, Dr. Shazli.
Okay.
All right. So, Doctor, how to solve hair loss problem due to methotrexate treatment for those with rheumatoid arthritis?
Right. So usually when you have this hair loss because of the treatment that I explained earlier on, you classify it into psychiatrical and non-psychiatrical. So if you have a methotrexate treatment, it's because of non-psychiatrical. So it goes back to the principle of physiology of the hair, whereas this type of treatment usually affects the telogen phase of the hair. The telogen phase, that means it actually prolong the telogen phase and it shorten the anagen phase. Again, when I deal with this type of treatment, I will tell the patients that as long as they are on that treatment, the medication, it will continue to affect the physiology of the hair. So, what you can do at the point of the treatment, you can just support the hair growth. You're taking the tips that I mentioned at the end of the lecture too. That means reduce stress and take a lot of supplements, good hydrations and all that. At the same time, maybe some shampoo or some of those boosters can help. But as long as the treatment is ongoing, unfortunately, the hair loss will continue to be there until they complete the treatment. And then you can reassess the patient, and then you can start, if they have already completed the treatment, given about 6 to 9 months, when the hair cycle starts to regrow back, then you can continue with the booster treatment. Yeah.
Okay, thank you, Dr. Shazli. And we move on to the next question. Is topical steroid helpful for treatment of alopecia areata?
Yes, actually topical steroid, because alopecia areata is an autoimmune condition, and memang the treatment is topical steroid lah. So because you want to reduce the action of the immune systems on that particular spot. And alopecia areata by itself, usually it's a self-limiting diseases, unless you are talking about a diffuse alopecia areata, which is very extensive. But yes, definitely. So most of my patients with alopecia areata, in my practice, I will actually refer to the dermatologist and I get them to see. And then actually one of the treatment modality is, of course, a topical injection of the steroid.
Okay. So the next question, this is one of the most common question I think experienced by our primary care team as well. For postpartum hair loss, what else can we advise other than reassurance due to physiological?
Unfortunately, memang
something else.
yeah, physiological. You can actually do macam tu lah, the tips lah, maksudnya hair treatments. Yes, I've seen a lot. In my practice, sometimes not only postpartum hair loss, when I do long surgery or when my colleagues they do this long surgeries that maybe last more than 6 to 8 hours. So because of the long surgery, the patient cannot move. So the compression on the scalp, it causes an ischemic situation where the hair actually falls. After surgery, 1 to 2 months, they have this hair loss. I've seen even on my own patient, because of the compression of the position of the patient, they actually have a transient hair loss. So for these two type of patient, we know at the end of the day it's a physiological process and it will come back eventually. So you just have to monitor the patient closely and reassure them 6 to 9 months, the hair will come. But again, you can do a lot of things like this topical treatment lah. So I mean, there probably be a lot of school of thought out there that they can give injection and all that. For me, I will just give them supplements, zinc supplement or selenium supplements again, and at the moment, and also some shampoo to actually boost the hair to grow lah. I will try to reserve doing things like PRP or stem cell, and even definitely not a hair transplant until at least 1 year after the delivery.
Okay, okay. So understood. And then we move on to the next question. Can shampoo in the market cause hair loss, doctor? And do you have any suggestion, any good shampoo that can be used?
Shampoo, yeah. I mean, this one is individual lah. You kena tengok content. So, I mean, it's difficult for me to really pinpoint and all that. Of course, it's individual. You need to look into the content, the response of the shampoo to the hair, a lot of factors lah. So, brand-wise, I do not endorse any brands in the market that actually can, commercial shampoo. So, but in terms of a specific shampoo for hair, yes, there are a lot. You can actually see in the hair industry, they come up with a lot of shampoos that can actually stimulate the hair growth lah. And some of them are those that natural formula. So you are not so worried the content can cause other side effects. So yes, but this is individual. So I do not actually endorse any brand.
Okay. So another question would be, I combined the question because it was asked by Dr. Ahmad Mahjudin. Is there an age limit for hair transplant, and does taking iron, vitamin D supplement help in hair loss management?
Yes. Okay. This is a very good question by our friend. So I think the second question first, definitely yes. Iron and zinc is good to actually not only hair and other parts of the body where contains keratin. That means even your nail, your skin. So these are where it will benefit. But not too much, because we know our own process, our own physiology also can create the supplements for this material kan. So maybe just a good dose, but not too much. For as much as age limit kan, so I think we look into the other aspect of it, not the age limit, but the entry point. This is more important. That means what are the minimum age that you can do. So this is something that has been for me is very, very important, because sometimes I've seen patients like as young as teenagers, early 20s started to do, and they must be actually explained. We might explain to them. When I explained earlier on, you see the donor site is actually finite number. So if you finish off the donor site and they have very bad alopecia, by the time they are 30 to 40 years old, they get a lot of balding problems lah, As far as the senior ones, I have no issue. I mean, I've done about 70 years old, 75 years old, so they're medically fit. They can do, because we can do this under local. You don't have to go for prolonged GA, and it's as long as the local dose and patient is medically fit, and you give the local under the proper dosage with good monitoring in the proper setup. It's actually quite safe to do lah. But extreme age like 80, 90 kan kita tak buat lah hair transplant, but 70 plus we still can do, yes.
Is it a daycare kind of procedure, Dr. Syazli?
It's a daycare procedure. This is something that the ministry is looking into, because hair transplant is if you want to give sedation to the patient, it must be done under daycare setup. So if there's a sedation under the rules of CCAPS, it must be done under a daycare setup, unless you give only local. But for the discussion point of view, yes, it's something that you do in the morning. And my patient, usually I will start at 8 a.m. By 4 or 5, they are finished, they go back.
Okay.
And they will come back the next day to do the shampoo.
Oh, right. Okay. Okay. Yeah. We move on to the next question. Can we do hair PRP after FUE, and how frequent?
It's actually not to say can, it's actually part of my protocol. So FUE, I will do PRP during the procedure, and then after that, I will do at least 6 times lah. That's my protocol, but it's not strict to say that this is the only protocol that you can do, but some centers they do more longer, some do shorter, but for me I do monthly. So that means before or during the procedure, then monthly after that, at least 6 times.
Okay, all right. Okay, yeah. So, yes, Doctor, can you comment on DHI technique and your experience and pro and cons compared to FUE technique?
DHI technique ni is by definition is actually direct hair implantation. So that means you implant the hair directly inside the FUE. FUE is what we call as the way you harvest. That is FUE. That means dia ada dua kan, I tunjuk tadi, FUE or FUT. FUT you potong a strip. FUE tu you ambil satu dengan guna that special machine. Whereas DHI ni is a direct hair implant. That means you ambil the hair and then you implant inside. So this one is actually where you take out the harvest. The one is you put it inside. So it's a different it's a different part of the surgical procedure. Direct hair implant ni dia pula ada dua pula. Satu dia guna yang I tunjuk tadi, guna machine. You put into the machine, you plant inside. Satu lagi you cut the slit and then you put the hair. So you know, so if you guna the machine dia panggil choy planter tu, you put the hair inside, you plant satu-satu. So that's what we call as a DHI lah. Not to be confused with a DHI company. DHI company ni is a company where they actually do FUE, but there is a company named DHI. But when talk about technique, is these are the two things, direct hair implantation.
Okay, all right. One side effect of hair transplant is scarring, and how do we prevent hair loss from this?
Scarring of hair transplant too is actually, yes, something that especially those with a tendency to develop keloid lah. I've seen some patients that did hair transplant and then they develop keloid on the scalp, which is very rare because keloid on the face is very specific. Usually it happens on the mandible and the earlobe. So on the scalp, very, very rare. But other than that, there is, if you do the strict technique, yes, the risk of keloid is higher because a long scar lah. FUE very, very rare. But again, if you want to prevent keloid, that is a whole new lecture because we have to look back into the wound healing process. We have to reduce the risk of infection, the risk of bleeding, and the tension to the scar and all that, you know. But what I do in my practice, at least I do some hydration to the donor site lah. That means post-operatively, we put some like Vaseline to the donor site, and then we monitor any infection, and then we monitor if there is bleeding. So these are the things that you can do in the acute phase. And if there is an early scar that develops, and the scar should be managed urgently because scar cannot be wait until it settles down. A lot of issues, especially medical legal, comes when the scar has been managed too conservatively. So when the scar forms after 6 to 9 months, then they refer to the plastic surgeons, for example, it's already too late. So scar should be managed in the early phase. Macam tu.
Okay. Okay. So next question will be how much is the cost for hair transplant, and is it related to genetics?
Okay. So we answer the second question first. Genetics, again, very interesting thing that people have looked into. So before this, people said that it's actually paternal or it's actually maternal. So it does. If you want to look into whether you're going to get hair transplant, you look into your grandfather's hair. Or is it on your father's side or the mother's side? So it's very interesting. Then people say it can be more of maternal or paternal, but there's not a strong evidence inside there. But yes, if you, it's definitely very much is genetic. So if father, siblings, cousins ada, unfortunately, you tend to get it lah. Some people, the hair macam, you know, like some family, you can see the hair until 70, 80 years old pun very thick. So you can see on the aspect is actually the genetic is strong. Cost-wise too, they depends on a lot of factors juga. So whether it's been done under GA, whether it's been done under local, whether patient is admitted, and whether the amount of hair, because hair transplant, remember, hair transplant is not only on scalp. So we can do transplant on, like I mentioned, those with post cleft lip, you do on the lip, those with eyebrow loss, those with beard. So these are other aspects that you do lah. But for the detail of pricing too, you can check with each center what they do. Usually they come up with a big package and you have to check with them.
Okay, okay. Few questions on finasteride, Syazli. Is it related to gynecomastia and how you deal with it? And then is it recommended for women in childbearing age?
Itulah. For the woman tu I mentioned tadi, there is some issues with teratogenicity. So the safety profile of finasteride in women is not strong. So probably if you have from the pharmacology punya inputs of the updates. But as far as I checked a few years ago, until now, it's not really being approved by FDA in terms of hair loss treatment for ladies. But for men, you can use as a part of the treatment protocol. But for ladies, because of that side effect profile, it also goes into the dutasteride part. So it's in the black box of the drug side effects. So you don't really see it as a safe for childbearing age lady. That's why we don't really do it routinely. For me, I would go for like minoxidil lah, for example, which is quite safe for ladies. In terms of the gynecomastia side effect, yes, this is one of the known side effects for the men. But from my clinical experience, most of the patients too, they don't usually have a true gynecomastia from finasteride alone lah. But yes, it's known to, or it's actually one of the side effect profile listed under finasteride. Even there's a risk for apa tu, prostatic CA and all that also is listed. But how much or how big is the risk is something that you will have to look into it lah. For me, I will disclose lah to the patient all this. I will tell them these are the risks, and then they will decide on their own. So I don't really hide these facts to them. But if there is a gynecomastia patient that comes after, again, the treatment of gynecomastia must be complete. You must not say, okay, gynecomastia only because of this, so straight away is because of finasteride. So gynecomastia, again, you must look into the patient as a whole lah. So the investigation must look whether it's a true or pseudo gynecomastia, and investigation must be complete again.
Okay, okay. So any precaution need to be taken after hair transplant? I mean, like a certain shampoo cannot use, or any restricted diet or whatnot.
Okay, hair transplant ni dia macam kita jaga baby lah basically. So like you have thousands of babies on the hair. So you must be like, when you have the hair, you want to make sure that the hair is alive lah kan, because so of course the fact is that it's not cheap, and then you just put something, you went through a lot of stress of the surgery, you don't want to go into vein kan. So some things that we do for the patient, first few weeks too, we have a special type of booster and shampoo. So this booster and shampoo ni macam baja lah. So we use this to make sure that the hair graft to grow very nicely. At least if they can cross the first month or first 2 months too, we know the graft already survived. Then we are not worried. So graft ni sama macam we do like any type of graft. Like in, in surgery, we can do skin graft, we can do nerve graft, bone graft. So graft must survive first. So when the graft survives, then we know it continues to survive. Now, after you go beyond that phase, so after 6 months, when the hair already grow and it's already strong, so it will continue to grow macam the hair yang dekat donor side. So then the precautionary measure tu goes back to the tips tadi lah. So that means healthy lifestyle, sleep, stress, reduce, and also, hydration. Of course, periodically, my patient will come for booster like PRP just to make sure that the hair is healthy. Itu saja. So other than that too, again, it must actually be from the beginning of the procedure itself.
Okay, all right. Okay, I mean, due to time limitation and question keeps on increasing, we will just choose a few questions that of clinical benefit to be answered. What are the recommended anesthesia for the ring block?
Okay, so now this is quite technical. For ring block too, there are a few ways to do it. And then to do and of course, number one, when you do anesthesia, in clinic setting, you must make sure that safety is important. Remember that. So, again, if you want to do anesthesia, the dosage and the emergency trolley and the safety of the patient must be there. Now, to do anesthesia ni, in my practice, I use a combination of ways to do. So, we can do what we call as a regional block, and in combination with a ring block. So, and then we also do a tumison. That means a ring block is when you inject at the point of the nerve. So we use a longer acting anesthesia for this. For example, like bupivacaine, and then a combination with Marcaine. And then you do after that blockage of the regional part of the nerve. For example, like you do the occipital nerve blockage. After you got that, then you go for the ring. So the ring, we use a shorter acting. Let's say maybe a lidocaine with saline. And then you can mix with tumescent. So that's the gist of it. But be careful. So again, I think anesthesia must be very, very careful. I think especially those that can affect the cardiovascular system. So macam Marcaine and all that. Be careful. So you don't want to actually risk the patient safety by giving too much or beyond the dose. Yeah.
Okay, so how long post hair transplant need to continue steroids and immunosuppressive meds?
I don't really understand this question because we don't really give steroids. We can give steroids to reduce the edema, macam prednisolone, but low dose maybe for 2 to 3 days lah. But you don't really give immunosuppressant for steroid unless you are talking about patient with condition like discoid lupus or autoimmune condition that affect the hair loss that wants to go for hair transplant. For that protocol, usually you wait for the thing to be in remission for at least 1 year. And then that will be under the medical specialist lah. So once it's in remission, the disease is controlled, baru you go for hair transplant. Tapi for hair transplant per se, we don't really go into immunosuppressant lah. If I'm not mistaken, the question, I'm not sure whether that will answer the question, but not a practice for us to give immunosuppressant for a routine hair transplant.
Maybe the one asking the question thinking a hair graft is something like organ grafting or something. That's what they're asking.
Faham. Yes, so
You
kalau
just
macam
thinking that's that.
yes, good. So yang tu, if you that's why hair transplant ni must be what we call as an allograft. Allograft ni maksudnya the graft from your own body. So you take your autograft lah. So own body we transplant. We cannot take graft from donor from other people. So we are talking about maybe like kidney transplant. So you take from somebody else, so you must suppress the immune system. That's why you give that. But this one is because in autograft, there's no issue lah. So we don't give autoimmune punya drug.
Okay, I think that's that Q&A from our session. Before that, Dr. Iskandar, do you have any questions from FB Live before we end the session?
Okay, thank you very much, Dr. Syazli, for the very fantastic talk. Actually, it does actually give a lot of light to us, actually, for those who have hair loss. So I just want to share to ask one question only. Do government have this facility? If no, because we know that actually it's kind of a bit expensive in treatment for hair transplant and other types of modalities. Does government hospitals actually offer this kind of treatment?
Okay, to answer that question too, I have to put a disclosure because I am currently in a private setup, but at the moment I am very closely linked to the Malaysian Society of Plastic Surgeons as their treasurer. So as far as I know, government, I do not know in detail whether they definitely can do, but they have to ask each of the unit by themselves. But as far as the practice of hair transplant among plastic surgeons is concerned, we have plans to actually train more and more plastic surgeons lah, both in the government and private sectors, to start been doing lah. So I think probably we are looking at maybe another few more years down the line too, there will be more and more units including the government setup that can do once we get the training in place. Yeah.
Okay, thank you very much. Okay, Adila, back to you. Okay. I think Adila have another session going on. So I would like to thank you very much, Dr. Syazli, for giving us talk today. Actually, we have about, including the Facebook live, actually we have about 224 participants joining us today, despite Raya time. Actually, I know that most of us actually out there actually busy actually going from house to house for open house. So I would like to thank you very much for all the participants joining us today. Your support has been a very, very good motivation for us to keep on doing the MedTweetMY professional webinar for every 2 weeks. And I would like to gratefully thank Dr. Syazli for spending his time to teach us about hair transplant. So remember, we already have this link for CME CPD point. So make sure that you enter the form correctly. We already have a problem, always have a problem with the email address. There's always a discrepancy about the email address so that you cannot get the e-certificate or the CPD point. So make sure you type in correctly so that we can actually give you the e-certificate straight away. So without any delay, I would like to thank you very much and see you another 2 weeks. Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera.